Hello, everybody. Thanks for joining this fourth annual of the International Day of Women in Statistics and Data Science Conference with this year theme, Thriving in Your Environment. We are recording this event and the videos will be available on the Caucus for Women in Statistics YouTube channel. We kindly ask you to post your questions to the speakers in the Q&A chat. So, without further ado, I'm delighted to host this session, the 403, the Portuguese Biometry Outside Academia, and to introduce the first speaker. So please welcome Diana Tereso Ferreira. She's a management of the Frutas Tereso, and she is also a vice president of both Algarve Orange and Fidacri, and who is dedicated to advancing Algarve agriculture. So I'm going to stop and could you please share your presentation, Diana?
Yes.
Thank you.
Okay.
You can put, yeah, nice, good.
Yeah.
Thank you, Diana. You may start.
Thank you. Hello, everyone. My name is Diana. I'm a young farmer. I'm trying to manage as good as possible my family company, that is Frutas Tereso, and I'm also very involved in ensuring that Algarve agriculture has a prosperous future. Frutas Tereso is a family-owned company. We are based in the Algarve, south of Portugal. We focus on production and harvest, packing, and selling the best citrus. We focus our work in producing with quality, with safety and sustainability, with a strong emphasis on customer satisfaction. We try to deliver fresh products, delicious products all year round. Throughout the years, Statistic has been helping farmers with the design of experiments with analyzing data, validating new treatments or techniques. But for me, by the end of the day, having to make decisions all the time, statistics help me taking informed decisions. Informed decisions are useful or are important because they are more likely to lead to positive results as they are based on data and evidence rather than intuition or guesswork. They are also important because by analyzing relevant information, decision makers can better identify potential risks and develop strategies to mitigate them. Informed decisions help also in the efficient allocation of resources. They ensure that time, money, and efforts are directed towards the most effective actions. With access to accurate information, we are able to adapt quickly to change when circumstances change, and we are able to make timely adjustments. Making informed decisions or making decisions based on solid evidence boosts confidence among stakeholders as they can see that choices are backed by thorough analysis. And not only, not only stakeholders, but this is also very important for us as farmers to present information based on thorough analysis to the government and to policymakers. So this is also another bonus to have statistics helping us in our daily basis. Informed decision making supports strategic planning by providing insights into future trends and potential challenges. And also when decisions are based on shared data, it fosters collaboration among team members and stakeholders, leading to more cohesive strategies. So this is how I see the importance of statistics and in our work regarding agriculture. At Frutas Tereso, we have been trying some things, some new things. We have trying to answer to some questions that we have, and throughout in the past years, we have making some experiments. I will talk about 4 of them. One, the one that we did first, the first one that we did, I'm sorry, it was to answer to this question: can pomegranate extract be used for the post-harvest treatment of oranges? Because at the time we also had the production of pomegranates, so we wanted to see if it was possible to kind of mix both products that we have. So we did the experiments with the extraction of with the extract of pomegranate. We used it to see if it had some efficiency on the post-harvest treatment of oranges. That means to enhance shelf life time of oranges, avoiding post-harvest fungus, the most common ones at least. The results were very interesting. However, we found that making pomegranate extract was very expensive, so it couldn't be used as an alternative to the methods that we were using at the time. The other question that we tried to answer, or we answered throughout by making a study, was what is the impact of a new fertilization scheme on the maturation of the earliest orange varieties? Oranges, we have in Algarve or in Frutas Tereso, we have different kinds of orange varieties, and it is this that allow us to have fresh fruit being harvested and packed and sold all year round. The first varieties to be ready to be harvested in October, by the end of October, early November. For those varieties, it is really important to have all the maturation indexes on a set. We have European rules that tell us which values some indicators have to achieve to be able to be harvested and sell. It is really important for us to be sure that the fruit that we are harvesting is ready to be on the market. So we tried 4 different fertilization schemes, and we found out that one of them could reduce acidity more quickly and could help us introduce these kind of varieties, the earliest varieties on the market sooner than our competitors. The other question was what is the effectiveness of some residue-free options in the post-harvest treatment of oranges? So every time a residue-free option for the post-harvest treatment of oranges is on the market, we test it in our facilities, and we compare it with the treatment that we have at the moment. Some of the treatments that we have been testing have good results, but only for 1 or 2 post-harvest fungus, not for all the fungus that we need to have good results. So for the moment, it was not possible to make this change. We are still using chemical treatment with a very few lower concentrate dose, but because residue-free options do not give us the results that we need to have for our clients. And the last question that I want to share, or the last test that I wanted to share with you, it was to respond to this question: what is the impact of climate changes experienced in the Algarve on the juice percentage of our oranges? This was something that we did with the Professora Clara, and we are trying we are analyzing data from 5 seasons now. This is the results for 4 seasons. The idea is to compare the percentage of juice from one of our earliest varieties, and to see how it is evolving throughout the years. We are seeing that the percentage of juice is decreasing, and we are trying to find why is that happening. We believe that is related to not only the temperature rise, but also to the more difficult or lowest access to the water that we are facing in the Algarve in the past years. So this is what we've been doing. We are trying to have more updated results using the latest data that we have from the latest seasons. But this is something that is really important to us, because we have to, as I mentioned before, we have to obtain a certain percentage of juice with our citrus in order to harvest them and to put them on the market. This is European law, but also certification from our region. And if we don't obtain that, we won't be able to sell our products as Citrinos do Algarve, that is a GPI, an European brand. And if we are not able to do that, we could face some problems with our sales. And so we are trying to show this to the policymakers, to convince them that it's really important to find solutions for water supply, and try to find different sources of water for our region. I wanted to leave also some thoughts for the future. And this is some ideas that we think could be really important to develop and try to find answers for them. So the first one is the estimation of citrus production, because accurate estimates help farmers and producers to plan their budgets effectively. They also help selling our products to make year-round contracts with our clients, and also to make investments regarding to shall we buy more fruit to other regions, because for this season we are expecting to have a lower production, for example. So this is why it is really important to have to develop these estimations of citrus production. Another thing that could be important is the analysis of price trends and prediction of market fluctuations. This is also important to understand consumers' preferences and adjust the production according to the demands. The other idea is the identification of factors that influence productivity. Assessing the performance of crops over time using statistical methods could allow farmers and agricultural researchers to identify various factors that could influence productivity, and then focus on those factors and maybe change crops, change soil conditions, change water patterns, agriculture practices in order to enhance productivity. And the validation and development of statistical models for the monitoring of pests and diseases. This is something that we are trying to find a budget with our regional governments to develop a platform that could help us identify as soon as possible the presence of pests and diseases in our orchards. With that identification, we could make a focused strategy to control those pests or diseases, and that could help us not only enhance quality, because we would stop or we would control as soon as possible these pests and diseases, but also we could enhance food safety with this, providing we would only have to treat whenever it was necessary, and that would enhance food safety. So this is what I wanted to share with you. In the last slide, we have this beautiful picture of an orchard of Frutas Tereso. And I wanted just to say that the agriculture sector is a fundamental piece of the Algarve and national economy. We are essential for food sovereignty, land use, and economic diversification. And we are also part, as you can see, of the Algarve landscape. Thank you for listening to my experience and thoughts, and I hope I have left you all eager to work with us, farmers. Thank you very much.
Thank you, Diana. Thank you very much. Just a very brief question that we have here in the chat for you, which is from Nuno. So Nuno asks you, Diana, do you have any statistician working in the company, or do you really on collaboration with the university or the Algarve to do a more advanced statistical analysis, or do you rely on a more statistical?
Yes, Professor Clara can also answer
I
to
can
that
answer.
question with me.
Yeah, thank you. So,
we don't have any statistics in our company. We have this collaboration with the Universidade do Algarve. It is really important to have more people working in this area. So we are trying to have funding for this platform that I mentioned. And if we have this funding, of course, we will be able to have people working full-time with us.
Okay. Thank you, Diana. Thank you so much. So now we can switch to Ana Marreiros. So Ana, you can share your presentation. So Ana Marreiros is a public manager and a professor at the University of the Algarve. And currently she is leading the Algarve local health unit here in Portugal. So thank you, Ana. So you may start. Ana, you are unmuted. Yeah.
I'll listen now. Okay.
Yeah.
Good afternoon to everyone. I'm going to present a work that is currently in development entitled A Novel Solution for Social Responses in Health Care System. Since 2024, I was invited to become a public administrator at Algarve Local Health Unit. And the invitation for this presentation came from the Biometry section of the Portuguese Statistical Society. And I'm grateful for this invitation and for being here with all these women from around the world. Thank you so much. I will present a management solution for acute episodes and hospitalizations while also having a basis in social public responsibility. The problem is what to do with patients who need both clinical care and social responses as users of the national health system. What should we do as administrators for an entire region in terms of clinical care when we have users who are in the hospital facilities with clinical discharge, but who have no home, company, or money to take care of themselves? This is a real concern for us. Well, we are in Portugal, in Europe, and we are managing the south of Portugal in terms of public system healthcare in Algarve. To get an idea of the scale of our responsibility, we have a turnover, a budget superior than 500 million euros. We have 4 hospital facilities. We have also 1,000 patients in bed. And related to academia, we have a medical school and we have academic clinical center in our health structures. So we have 200 units between primary care and hospital clinical services. But it's important to say that our 4 hospitals are distant plus 200 kilometers from each other. We have also 6 emergency services. We have 7,000 healthcare professionals, and also we have almost a coverage area, almost 5,000 square kilometers. Our region have 16 municipalities and cover more than 60 primary care units around all the territory of Algarve. The dietary pyramid is inverted. We are an elderly population. We have more than 500,000 registered users in health primary care system, and a concern dependency index above 50%, almost 60%, and this is a huge problem. In terms of clinical assistance, we are the first in episodes of emergency care, the second in number of births, the third in population served, the fourth in number of beds, but our health unit is the 9th in health assistance production. But we have also a problem. We have a very low funding with comparable with others local health units in Portugal. Well, our reality now, the global costs are increasing, essentially with human resources. There is also an increasing disengagement by the health professionals, and the offer of the private hospitals is increasing in the same region in Algarve. There is no reforms for over 30 years in national health system in Portugal. There is a lacking and an inflexible legislation for us to manage with more freedom our health units. Algarve is also a tourism region that there is also a negative consequences for the local.
Oops, Anna?
Worst in terms of cost living. So the social care loop gets also worse. There is fewer discharges, more readmissions, and longer stays in health structures. So the problem is that we are having more and more cases that go to the hospital, have clinical discharges, but they don't have any social support to get out from the hospital. And again, this is a very big problem for us. So we have 2 main questions to answer. The first one is, at what point do we cease to have clinical responsibility for these patients? And how can we answer these social episodes without dehumanizing them? So we start to develop a clinical score based on clinical records, initially in emergency care unit, based on vital signs, risk factors, blood analysis, exams, chronic disease, etc. And also, we start to read a lot of records, essentially nurse records, and we also start to develop a social score based on nurse records. According to big dimensions as like domestic violence, bad nutrition status, isolation, poorness, etc. There is one example of one nurse record and another example for a nurse of a nurse record here. As you can see, many sentences about social care needs, etc. Well, this course that we started to develop will belong to a 4-dimensional vectors, one vector for clinical assistance and another for social response needs. What do we have? So we start the solution with a 4-dimensional B-vector model for simultaneously clinical and social responses in the hospital environment. And this is our B-vector model. And we have a H vector and we have a S vector. H, this is the clinical vector, and the S are the social vector. The clinical vector have 4 coordinates. The first one is emergency clinical care needs score. The second one is the time in health system since the moment K. The third coordinate is the emergency clinical care needs score at hospital discharge at moment TM. And the fourth coordinate, H4, is the health system follow-up response after moment TM. The social vectors also composed with four coordinates. We have the first one with social response needs score. The second one, the time in health system since K, the moment K. The third coordinate, social response needs score at social discharge in health system at the time TM. And the last coordinate, the social system follow-up response after the moment TM. So I will present you an example, and when the time I will present you an example that is when the time of the clinical duration is equal to the social duration response. So here the patient starts with the emergency clinical care needs score of minus.
Anna? I think we lost Anna. Uh-oh.
0.1. That means is near from 0. So the patients get the hospital discharge. Also, with the clinical episode duration, the patient improved the social
Anna? Some difficulties with the internet.
Of a clinical discharge and social response for this patient. This is a good example. But on the other hand, we have an example that the duration in hospital is much more than the clinical needs. In this case, the patients had clinical discharge in 1 day, but stayed in the health public system 17 days because we didn't have a response for the critical social case. As you can see, we had much more costs, but not because the clinical episode. So the data-driven solution for healthcare provides with this logic.
Anna? We lost you again.
I finished my presentation.
Okay. Thank you, Anna. So I don't know if you realize, but during your presentation, we lost you, I think, for 5 or 6 times. But well, but you are on time. So Well, it's the problem with the internet. So thank you, Anna.
Okay.
So
Thank you so much.
thank you. So now we are going to our last speaker. So Valeska Andreozzi, she's a senior biostatistician at Exigo Consultores here in Portugal, with the expertise in biostatistics, epidemiology, and health technology assessment. So thank you, Valeska, for accepting this invitation. So you please, you can share your presentation.
Yeah. So can you see my presentation?
No,
No?
no.
Oh, okay.
Ah, see, now it's going to appear. So let's wait a
Okay.
little bit. Yeah, now it's perfect. Thank you, Valeska.
Now let me just do here. So welcome everyone, and thank Nuno Sepulveda that in behalf of the Portuguese Biometric session invited me to be here and participate in this lovely session. I'm Valeska Andreozzi and I work for Exigo Consulting. And today I'll be present on the whole of statistics in health technology assessment with a focus on the Portuguese context. Here's what we are covered today. We'll begin with an overview of HTA, health technology assessment, then explore its role in Portugal. We'll dive into the methodological and statistical frameworks, highlight key challenges, and close with reflection on the role of statisticians in HTA. So health technology assessment is a systematic evaluation of medical technologies. Its main purpose is to inform decision makers about reimbursement, pricing, and clinical adoption, ensuring that healthcare systems maintain a balance between innovation, effectiveness, and sustainability. For data scientists, this means working with complex data to ensure innovation and both effective and sustainable. In Portugal, Infarmed is the national authority responsible for health technology assessment. It plays a critical role in ensuring that the National Health Service remains sustainable. And as a statistician, our work supports this decision by providing robust evidence. Let me just close this because, okay. So this slide outlines the HTA process for pricing reimbursement of a drug from defining the PICO, the Population Intervention Comparator and Outcome Framework, to therapeutical and economic evaluation. We use health economic models such as decision tree, Markov models, and discrete event simulation, and budget impact analysis, areas where statistical modeling is essential. So what are these health economic models? So these are important to establish the costs and benefits of a new treatment. So why are models used? So clinical trials are limited in duration and often do not provide all information necessary for healthcare decision makers to allocate resources. So the use of modeling to extrapolate health benefits and costs over a specified time period is a common technique in cost-effectiveness analysis. So what is a cost-effectiveness model? A cost-effectiveness model is an analytical framework used to synthesize information on a range of variables: natural history, clinical efficacy, health-related quality of life, resource use, and costs, in order to estimate lifetime costs and benefits associated with two or more interventions. And the most common output, the health economic analysis, is the incremental cost ratio, we would call ICER, which captures the relative difference in costs and benefits. So everything that we are going to do in terms of statistics and all the challenges we have in the health technology assessment is to give at the end these outcomes, produce this outcome. So what are these statistical challenges in HTA? So HTA often deals with limited or incomplete data. We must extrapolate beyond trial durations, handle with indirect comparison, and adjust for complex trial designs. So these are the classical challenges for statistician and data science in this area. Randomized clinical trials often have short follow-up period, and we have to use, for example, parametric survival modeling, flexible models like Rostone Parma to extrapolate what is observed in the clinical trials. Q models are also useful when a portion of patients are long survival, and sometimes we need to take into account competing risks. So these are all what we need to produce estimates long-term to give information, to give evidence to the decision makers. Yeah, the best press when we have this kind of problem, we face these problems, is model selection should balance statistical fit, but also clinical plausibility. We validate models using external data and conduct sensitivity analysis to assess uncertainty. And these are the key principles in any robust data science. Another situation we found in the HTA when we are producing this cost effectiveness model, for example, is the lack of a head-to-head clinical trial when compared treatment A with treatment B. So when head-to-head randomized clinical trials are unavailable, we have to rely on indirect comparisons. And the techniques we use for that is conduct a systematic literature review, and then synthesize the evidence through network meta-analysis, or using the population average methods called matching adjusted indirect comparison or simulated treatment comparison. These methods require careful statistical handling by the data scientist. And to ensure systematic reviews are high quality, we should use patient-level data whenever possible, and always explore heterogeneity and potential bias to produce to have statistical insight in this situation. Another example that I bring to you when working with data analysis in health economic models is the problems that we found in some clinical trials that allow patients to switch arms during the conduction of the trial. So when crossover is allowed in these clinical trials, this crossover can bias, for example, when we are estimating the survival time of the patients in a treatment compared to other. So we use methods like ranking preserved structure failure time model or inverse probability of censoring weight that require strong assumptions and collaboration with clinicians to interpret results correctly. So here, collaboration with clinicians to understand the trial context, conduct a scenario analysis, and report assumptions very transparently is the key to have success in this the conduction of these methods to control for crossover in the clinical trials. And the last example that I bring to you is the real world evidence. Sometimes what is happening is that the marketing authorization holder have to produce evidence in the real world to confirm what is seen in the randomized clinical trial after some time the new treatment is on market. And the whole of the statistician is to participate in the protocol development, design a very good statistical analysis plan, participate in the data collection, and also in the data analysis and reporting. So I bring here some examples that I was particularly involved here in Exigo Consultores, that was the study rewrite. That is study, the objective was to study the effectiveness of trifluridine tipiracil in colorectal cancer. We had another study called parenteral, that the objective was to see the clinical, economic, and humanistic impact of short bowel syndrome. All of these studies were made in Portugal, were conducted in Portugal. And the other study that is an example of this real-world evidence is the Cordeiro study, that the objective was to cause the illness and study the quality of life of patients and also caregivers of patients with Duchenne muscular dystrophy. These 3 studies were also published in the scientific literature. So in what kind of methods in these real-world evidence studies in the context of HTA we used? So we used the mapping to reduce confounding. For example, propensity score methods and coarse and exact matching. Lots of regression modeling, especially when we have longitudinal data analysis and survival analysis. We have to handle missing data, for example, using multiple imputation, and calculate the economical burden and quality of life analysis. So these are the core data science skills that usually here in the company we need to know when we conduct these real-world evidence studies. And for best practice in this real-world evidence, we enhance the reliability of the observational HTA studies. We should pre-specify our statistical analysis plan, ensure data quality, and align endpoints with clinical objectives. So the statistician, our role as a statistician in health technology assessment context is to bridge evidence generation and decision making. So ensure methodological rigor and communicate uncertainty effectively. All these together are the skills that are increasingly vital in healthcare analytics.
Valeska, I'm sorry for interrupting you, but we are almost out of time. So could you please move on to your concluding points?
Yes, this is the concluding point.
Oh, okay, thank you. And I'm sorry for interrupting. Thank you,
okay.
Thank you.
So just some message to take home. HTA is essential for sustainable healthcare system, and statisticians are central to addressing evidence challenge. Transparency, sensitivity analysis, and collaboration are key for success when constructing this bridge. So the future lies in integrating real-world data and, of course, artificial intelligence. So thank you very much for your attention, and I'm happy to take questions if we had time, but if not,
Yeah,
that's
no,
okay.
there is another session now, so only a few seconds. So just a few seconds just to say thank you very much for accepting this invitation, and also to all the people that are seeing us. So thank you very much, and we move for the next session. Bye-bye.
Bye-bye.
Thank you.